So Mr David Boyle was born 10th of the 10th, 1930. He was admitted 5 days ago through the emergency department following a workplace accident while mustering his cattle. He sustained bilateral fracture of pelvic rami following a fall from his quad bike. Prior to his admission, though, he was a healthy, active male, wasn't on any medication, and rarely saw his GP. His last visit to a GP was 5 days ago for an infected cut. He was put on a wound management plan and given a tetanus shot. He's on no antibiotic therapy. He is allergic to penicillin. And he's married, living with his wife and 2 young children.
This is his.
And to set the scene, we're in an orthopaedic ward.
And that's his other hospital. His other child. Just trying to think what the grandmother is. And what time? They didn't give us a time as to what we. Oh, that won't be anything to do with it. Are you all right?
I got really bad pain.
Okay. Now, what sort of pain is it?
It's like someone's putting a branding eye on my chest.
Right. Okay. Well, let's take that. How long has it been going on for?
About 15 minutes. I reached over before just to grab the water off the table, and it just started.
Right. Okay. With pain, you would need to get the doctor, I think, or our nurse unit manager. Okay. And he doesn't seem very able to communicate. He's more concerned about the pain.
Okay. So what do you think you want to do first?
I think, well, that's why I've called you, because I straight away think he's a well person.
Yep.
Would I have time to do like obs?
Yes.
Can I go to the obs?
Okay, we're just going to take a set of obs.
Can't breathe properly.
Oh, he's injured as well.
Yes. Well,
I can't breathe properly.
We could set up a machine. Oxygen. Right now, where is the port for that? There, yes.
I think I'm having a heart attack.
His temp's 37.5. His heart rate's 110 and regular. His respiratory rate's 24. BP is 130 on 80. And he's at 92%.
Turn the oxygen. How is that?
I can't breathe properly. It hurts too much.
It hurts too much. Okay, well, also it's very important that you try and relax a little bit, all right? We're doing the assessments and we will get the doctor to come and check you out.
What are you doing for me?
Well, we're going to give you an ECG now and just see what your heart's doing. So what's the pain on the scale of if 1 to 10? It's a?
That's 7.
7, right, okay. Is this the first time you've ever had that type of pain? Right, let's do this.
Okay, David, we're just going to do an ECG on you, okay? How are you going, Mrs. Is it getting worse?
We're just going to open up your shirt. We need to just place the stick. Can we put the head part up? No, not really. I think bed controls. Can we raise them?
Probably a manual one, you may have to.
Okay, maybe it's oh, here we go. This looks like
It's up and down. No, at the end here,
that's
down.
at the end. He's having trouble breathing. Right, I'm just going to raise the head of the bed for you a little bit.
Wrong one. Other side.
Wrong.
Doing the
Backrest. Oh, right. How's that feeling, David?
Okay, so while she's doing the ECG, yes. Quite distressed.
Yes, he's distressed, can't breathe.
Yeah.
Okay.
So there's a phone over.
We've got Richard, yes.
You've got Richard, and there's a phone just over the other side there.
Okay. Okay, I just need to put this on. Hello, Richard. This is Claire Kent down in the ward of Dead One. We have Mr. Howell, who is the like level 7. And he's also said he's having difficulties breathing. We're setting up an ECG and we've done his obs. And did we just check a moment? Are his obs normal? And he's 130 over 80. And class is 110. Okay, and what else can we do as well? Sorry.
Okay, David, I'm just going to take an ECG. I need you to try and stay still if you can.
Yes, he had a fracture and a accident and a fracture of the pelvic rami. You're in the hospital? Yeah, 12 days ago. And
What are you doing for me?
I'm just performing an ECG. I'll just take the rhythms of
If you press quickly, it won't hit by copper.
okay, sorry, and this is 4 milligrams.
I can show you an ECG.
Okay, some GTN.
Okay, we're just going to leave them in place.
Yes, yes. So
What
now
are the instructions?
he would be down shortly.
Okay.
Yes, he asked for the obs and it was he on oxygen and he was coming down.
Right here.
Okay, he's right here.
Hi, Richard.
Richard, I'm Claire. I called you. Good morning.
Hello, Mr. Hoyle. How are you? My name's Richard. I'm a junior doctor working here in the hospital. How are things going?
I can't read properly.
I'm just going to give you according to your orders, point 4,
Okay, great.
GTN. So,
Thanks very much. Maybe we'll just bump that up to a little bit higher flow,
like
to about 10.
about 10.
Yeah. What's your name?
Danielle.
pain, all right?
I think I'm having a heart attack.
Yes, I'm sure you feel that. Just one moment. Let's just put a squirt under your tongue.
Great, thanks. Now that is meant to relieve some of the pain in your chest, so we'll just see how that goes. Let us know if that pain gets worse. Right, has the ECG been connected up to the machine yet at all?
Yes, the ECG has been done.
Okay. Can we have a quick look at that?
I'm just going to put this back. Results of your ECG. Breathe, take deep breath.
It hurts when I breathe.
Does it? I'm sure.
I presume
Well,
this is
you're
lead
just
2.
in the best
Once we
hands.
read
We're working on finding out and
That's lead 2. Is that the rhythm strip at the bottom?
No, we don't have the rhythm strip, just shows us sinus tachycardia.
Okay, it's just sinus
So
tachycardia.
having a look, reviewing everything, and we'll come up with
Some SC elevation in the
right
lateral lead.
treatment for you. In the meantime, you concentrate on breathing.
I can't breathe. It hurts.
Okay. Try and relax as well. Try deep breathing to help relax.
What are you doing for me?
Doing-
I can't breathe. It hurts.
It feels
What
like
we've
an
got-
edge, but we're trying.
What we've got you on is some oxygen, which will just improve some of your breathing, and the GTN, which is the spray, will hopefully release some of that chest pain. If it doesn't, let us know. We can give you something stronger as well. So we'll just wait a couple of minutes, see if that works. Give it maybe 2 or 3 minutes, and then we'll try something stronger if it doesn't really kick in. So we'll just hang on for just a second. So what we're thinking is maybe he's also got a pulmonary embolus as well, which is probably quite high up on the priority list as well. In which case you might need some stronger pain relief, because GTN wouldn't be relieving that as well.
When I have a heart attack, I can't breathe in. It hurts when I breathe in.
Yeah, it doesn't look like you're having a heart attack based on your ECG results. It's probably more likely pulmonary embolus.
What does that mean?
Basically what it means is you've got a little clot in your lungs.
Does that mean I'm going to die?
No, not necessarily. It is a serious condition and we'll treat it as best as we can. So I'll just ask one of the nurses if you can to draw up 2.5 milligrams morphine. And I'll get IV access as well. IV access on the morphine?
Yep, okay. Yeah, that can be done a little bit later, but the morph is the
Okay.
Tourniquet.
Does that coughing aggravate the pain?
It hurts when I breathe in.
It hurts when you breathe in specifically. Alright. Does the cough make it worse?
I don't know how this works.
Okay. It's just like there's a little bit on that
Oh,
side.
that's how I was trying to stick it in the other, right.
Right, we're just going to pop a vein in your arm here. A little needle in your vein. Is this bag released? Yeah, thanks. I haven't cannulated this arm before. How's the pain going now? It's really bad. we'll give you some morphine. Have you given
No, just joining.
Okay. Morphine's just coming on its way. That should relieve your pain quite significantly. Alright.
And it leaves you more than if his pain doesn't resolve and just give him another 2.5.
Yeah.
You're ready to go again.
Okay.
So you've recently been on the wards with the motorbike accident? Yeah. Alrighty.
I still can't breathe.
Okay.
David, I'm just about to give you 2.5 milligrams of morphine, so hopefully that will help with the pain. Okay, just giving it through the eyes and nose. Thinking your pain is going to straight away. We can get sorted for you ASAP, okay? Can I just check your armband?
As soon as you've done that, just to take the patient's hands again.
Thank you.
So there's your board. So you
I've got to do another set of gloves.
I can't breathe.
Yes, David, I promise you are.
Oh. Sorry, I turned off or you're going to get blood everywhere. You should be right now.
For the registrar's number. I'll Taylor, go forward.
I'll make it okay. So if you sign that and then we attach that to the syringe.
How's the pain doing now?
A little bit there. It's still wet.
Alrighty.
And then you can leave that with him. Beautiful. Thank you.
If his oxygen drops below around 88%, we get concerned. What I think I want to do is just have a look at the vitals that have been taken. Because my impression so far is he's probably had pulmonary embolus from punctured pelvis. I'd like to just give the registrar a call, see what she thinks, whether it might be wise or not. So yeah, if you wouldn't mind just keeping an eye on the oxygen while I give them a ring. And just if you have any pain, I'll write up another order for that. If he needs any more morphine, I'll just scribble that up as well. Okay, still?
How are you feeling now, David? Is that pain easing off at all?
It's a little bit better, but it's still there. Still can't
Okay,
breathe.
so we've given that morphine, so hopefully it'll just continue to get a little bit easier for you.
Maximum dose, we'll stop it at 10 milligrams.
Okay.
How's his O2 stats then?
O2 sats 98. I see.
Okay, so that's gone up good.
Yeah.
Yeah, on
So
6
let's
meters.
see. 2.5. Indication.
So he's had 2.5 milligrams of morphine.
Did we put, is that IV?
Yeah, 3
Yeah, I think.
So 2.9 is O2 stats, okay, 4 below 88%. Not to worry.
Okay, I think that's all I got to write. Dose 2.5.
Feeling no.
Group 5E.
Easing up anymore, David?
A bit better.
What would your pain be out of 10 now?
About a 4.
A 4. Okay.
That's better than 70. But you see, you're really coming across it.
Could I just have a look at those mics?
We were given those. I did my own.
So what did you actually check?
Eyes
Yep.
and
No.
peripheral fusion.
His peripheral fusion's good. Yep.
So it's under 2 seconds. Whether
Yep.
he's got any pallor, central cyanosis,
No, that's all normal.
that's all normal. Heart sounds,
Normal.
dual sounds, pericardial rub,
No, it's no
nothing.
rubbish.
Okay. Pulse rate is done by her as well.
115 regular.
15
Yep.
regular. Just had a quick look at his injury site to see what I could see.
Yep.
Is that just got
Yeah.
surgical scar or whatever? Didn't see anything. Okay.
Just breathing.
Just breathing. That's pretty much all I did.
So you listen to his chest?
Yeah, listen to the chest as well.
Okay.
To see if there was a rub or any
Yeah.
adventitious
Okay, so
sounds.
percussion notes, normal.
Okay, oh yeah,
Yeah,
always.
and the breath sounds are normal.
Yeah,
Okay.
okay.
So you didn't hear any rubs or anything
Okay,
like that
so
at all?
rest
So
is normal.
did you check anything else? They told me you did check one other thing. You checked his JVP?
Oh yeah, look
It's
at
normal?
JVP, that's normal.
Yep. Anything else that you checked?
What else did I do? Or what should I have done?
That's okay. That's all
Kind
right.
of juggler. That's what I suppose I could have done. No, I think that was it.
So you must be just about up to
History examination
ringing
to
the
ringing.
registrar.
Yeah, I'm
I'll
just sort of
swap
getting
roles
the
now
history
then.
together.
Yeah. Yeah, okay.
No, I can't. He'll ring his registrar
And get,
and he'll get orders
and
for an
let us know.
anticoagulant. Yep. Reassuring because so
I was just wondering, she's also got
How are you feeling now?
he's been given 2.1. Just one more. I was just wondering whether you'd like to either see him or whether consider the possibility of a PE and what you'd like me to do about that. Sure.
We're just going to take another set of odds, David.
Just needed to check a couple of things. We needed to get his blood pressure sitting and lying. I spoke to the registrar. She's happy with the diagnosis of pulmonary embolism at this stage. There's just a few more investigations we need to do to confirm that. So we need to get his sitting and lying blood pressure. Would you be able to take some bloods for investigations? Do you know how to do it?
No.
Okay. Okay. Are you able to just write up? Are you able to write forms up, or can you find a couple of forms?
I can
for
get
me?
yes.
Okay, that'd be great.
Blood count?
Okay. Yeah, we just need blood count. Just the pathology forms.
Okay, yeah, I'll get them.
Yeah, 2 diamonds, whatnot. Okay, and also radiology if you have any. That'd be great, thanks. Okay, so we just need his blood pressure. And then some Clexane, 1 milligram per kilogram. So I'll just write up that order, and as soon as you've done the blood pressure, that order should be ready. We can give that to him as well. Okay, great. Thank you.
Thank you. Let me just sit you up a bit higher. That was...
It might aggravate the pain a bit, Mr. White.
Yes, it might be, but we won't be long, and then we'll lie you down.
Clexane.
1 milligram.
Per kilogram. Okay.
Yes, I think let's just check Yes. Right.
Standing.
So let's go Clexane.
Yeah. 90 milligrams. So if you can just get that ready, I'll finish.
No worries, yes.
Thanks very much.
David, just one more time, we'll inflate the cup and do the breathing. How are you feeling now? Is it easier or not? Is it easier to breathe when you're sitting up?
It hurts though. Can you put me back up?
Yes, I'm going to put you up right now. Right.
David, I'm just going to give you a Clexane injection. Now what this is, it cleans out your blood. So the doctor was saying that they think you might have a pulmonary embolism.
What does that mean? Am I going to die?
No, you're not. You'll be right. We're doing everything we can. It's just like a blood clot, okay, that forms in your lungs. So what the Clexane injection does is thin out that blood, okay, hopefully to with the blood clot, okay. So I'm just going to give you this little subcut injection. It won't hurt too much at all. You can have this in your tummy or your leg. Where would you prefer it?
Tummy.
Tummy, okay.
I would say it would be in a minute before, yes. It would have been.
Patient? Yeah? You got any comments to make about how you felt?
It's just took too long for the nurses to come over when I was pressing the button. I was freaking out and I was coming back.
It's probably quite realistic though, isn't it?
Yes, I heard a buzz, but know where it was coming from.
Didn't know whether it was yours or not.
Yes.
But the time, you're right, the time frame is probably very realistic from a ward perspective. Yeah. How did you feel in terms of communication?
Yeah, I feel it was explained reasonably well.
Do you feel included in it?
Yeah, I guess some of the stuff when you were saying the subcut and stuff like that, I have no idea what you're talking about. But yeah, I don't know what you're doing there. Maybe I could have explained a little bit better. Other than that,
From a nursing take, how did you feel?
Thrown in the deep end, I think, because it was like real. It wasn't just a dummy in the bed.
Yeah.
And so it is, I find it quite daunting. Very.
I think you did it really well, like especially the initial conversation that we had. Everything was clear, and all the questions I had, you knew the answers to straight away as well. So that was really good.
You did really well. You did a really thorough assessment. Once you were in here, you did a really like you got the pulse. You questioned about the oxygen. You rang me as the nurse manager and said, "Can we just initiate the oxygen? Can we do the ECG before we ring?" And then you rang your doctor, which you gave him a lot of information. Yeah.
And then you came on the scene and you were pretty quick to get the right diagnosis.
Yeah, but I probably should have examined him for, that took me a while. I was more concerned like with his pain and his distress. I don't wanted to leave that, and I probably should have at least done a bit of a more thorough assessment before. Like I just went on the route. Yeah.
I think you would have in a real situation done that. Also, the examination process is a reassuring process in itself anyway. You're actually, touching, examining the patient and talking to them while you're doing it. So that's actually part of reassuring them, and it's a really important part. So I think you're right, yeah.
Yeah. But given his history, that's fine.
Yeah. Certainly you jump straight to a correct diagnosis, but it is always important to think about the possible differentials, and it was important to check things like his line check his JVPs.
Yeah.
So you've got to do this all over again, don't you?
Yeah, no, when you said trickier. No, I shouldn't.
Do you actually have TEDs on?
I don't know. I didn't have a look. As I said, I could have done a better physical exam.
Yeah.
I don't think I did that very well at all.
And from a nursing take, if your walker makes the diagnosis of a PE, you can say there's no TED, there's no vaccine, whatever, he's been in bed.
No TEDs on.
It's about working together.
Yes, yeah, and that's good. How did you feel when he said to you, I think it might be a pulmonary embolus, and you said, am I going to die? How did you feel about his response to that?
Pretty good. Yeah, I think it could have been slightly more reassuring. Told me to explain like a little bit about it.
Necessarily. I don't know if reassuring. I mean, that's a correct answer.
Yeah. Okay. So break it a bit easier.
So yeah, it's serious, but no, we'll have everything.
Yeah.
But I think dealing with the pain and stuff was pretty good. That's what put me easy. That was like
Yeah.
with the pain.
Yeah.
And if you get any chest pains, we drew that morphine up 10 in 10 so that you can give the 2.5, but if his pain doesn't settle, you've still got more on hand. You don't have to worry about going and redrawing things up and labelling things again. So it's here and it's on hand because you're not going to leave someone like that. So you're here with the medication you've drawn up anyway. So it's okay to have that.
And how did you feel you were with his cannulation?
I think, because it's on a plastic model, it obviously makes it high.
Yeah.
And you forget to do things that you would in a normal patient, like putting the pillow under, gloving up because there's a transfusion, infection risk, all those sort of things when you're just on a plastic model, just to go straight into it. But,
so it's important to try and keep it as lifelike as possible.
Yeah,
Gloving up is important.
Yeah.
I agree. In real life, you would have done it.
It doesn't cross your mind when you're on a model.
Yeah. But also, always think in a situation when you're putting in an IV, do I need to take blood? Because it's far easier to put your finger up with the syringe in, take the blood, and
I was going to do that afterwards.
Yeah, but then you're in a bit of a dilemma because you can't take it out of this arm, can you? Because you've got the cannula in and you've got your IV fluids, so you'd have to pretend to go and take it out of this arm there. But it's always, just think about that.
Yeah.
Putting in an IV, do I need to take blood? So now's the time to do it. When you do it, I mean, they're just little comments because I think basically you did really well with that. So did you feel reassured by having him there and how he was explaining things to you?
Yeah.
For the first scenario, you'll find by the time you get to number 4, you feel a lot more comfortable with it.
Well, I noticed all three of you to start off with were a little bit awkward, but just as it went on, it just seemed like you forgot the camera, and it just got more and more natural.
Well, I've never really worked with nurses. I'm always thinking about myself, what am I meant to be doing? It's really hard to be thinking, what are you guys doing? And any feedback, anything you think of as well, would probably be good. If you think, have you checked, she was saying, have you checked the stats? Or would you like me to check for this? That would also really help because I forget as well.